Today we'll be talking about who I am, what my job is in the military, how my job affects the squadron, wing, and big Air Force level missions, how my job supports the core mission of the Air Force, and what would happen if I wasn't good at my job or if my job didn't exist in the Air Force. So as an introduction, hello, my name is Rebecca Burnfield. I am a 4Y051. That means I'm a dental technician in the Air Force. I have 7 years of career field experience. Out of these 7 years, I have 4 years of military experience. My civilian job includes being a dental hygienist and also being a current student at WVU. My hometown is Greensburg, Pennsylvania. My extra duties on the base include being a student flight supervisor, a suicide prevention spokesman, and Airman of the Year for the year 2019, so that's actually this year. And also I participated in youth leadership as an instructor in the year 2019. I don't currently have any deployments, but I do have 2 dental humanitarian trips under my belt, one in rural West Virginia and one in rural Kentucky. As a dental technician, what do? I mentor younger airmen at my job. I help the dentist perform and carry out tasks such as oral surgery, jaw reconstructions, and tooth removal. I do cleanings. I do dental maintenance such as helping the dentist fill cavities. I help the dentist in performing orthodontics, so putting on braces, taking braces off, jaw reconstructions. I help the dentist with performing pediodontics, which is working with children. I prepare patients for the dentist in reviewing patient medical histories, taking x-rays, answering questions that the patient might have, and taking patient vitals before the dentist comes in the room. I help organize and clean the clinic, including the equipment and instruments. How does my job tie into the medical squadron's mission? Thank you for asking. Our bodies are systemically designed. What goes on in your mouth affects your entire body. The presence of bad bacteria or disease in your mouth is a contributive factor to heart disease, diabetes, hypertension, edema, which means swelling around your body, and other illnesses. When we remove this bad bacteria from the oral cavity, the chances of these systemic diseases are greatly reduced, and the overall health of the Air Force members and life expectancy is increased. Providing great dental care is one component of the mission of our base's medical group mission to maximize the health of our patients in the community. Without dental care or well-performed dental care, military members are not provided with optimal health care, which directly goes against the medical squadron's beliefs. Dental care needs need to be seen as health rights and not as health luxuries. Innovative delivery models include great dental care because they understand the importance of systemic health, which has been proven through medical research and studies in education. If my job does not get done well, what happens? Without dental care or quality dental care, patients cannot receive relief or eliminate oral or dental pain. They will not be able to carry out the mission comfortably or without distractions. Air Force members could die from infections or secondary diseases. Air Force members' quality of life decreases. This will cause the Air Force decrease of retention. Members who have died tragically will go unidentified because they will not have properly documented dental records or any dental records at all. So one important quality of my job is that we are in charge of diagnosing bodies whenever they're not able to be diagnosed in any other way, because often their dental records are still intact, their dental features are still intact, so we're able to identify bodies in that way. Members will suffer from psychiatric distress about the appearance of their teeth. Members' diets and nutrition will suffer from dental complications and the inability to eat certain foods. How does my job and squadron's mission tie into the wing's mission? Our wing would not be able to function without the medical and dental section. People from the wing would not be able to accomplish the mission without being physically and mentally prepared. Mental health issues would not be addressed. LOD, so these are your line of duty incidents, would not be documented. Bodies killed in tragic accidents would not be able to be identified for families without medical or dental records. Wing members would die unnecessary deaths and have a lower quality of life if the medical squadron or dental flight did not perform their duties well or at all. How does my job, squadron, and wing mission tie directly into accomplishing Air and Space Force core missions? The core values, air and space superiority and rapid global mobility, are accomplished by my job as a dental assistant, medical squadron, and wing by increasing the deploying abilities of our unit. Our unit being medically prepared and ready to go in a minute's notice allows rapid global mobility and air and space superiority. Global strike, command and control, intelligence, surveillance, and reconnaissance (ISR) professionals would not be able to perform their jobs if they were not medically fit to do so. Today we discussed who I am, my job as a dental technician in the military, how my job as a dental technician affects the medical squadron, the 130th Charleston Airlift Wing, and the big Air Force mission. I talked about how my job as a dental technician supports the core mission of the Air Force, and we discussed the effects of my job not existing or not doing my job well.